Hello, I'm Joan Justice with HealthWorks Collective, and I'm here with Dr. David Albert, founder and CMO of AliveCor. Dr. Albert has a background in medicine, biomedical engineering, and he's a serial entrepreneur who holds numerous patents and has developed and then sold several medical device companies. AliveCor's mobile heart monitor for iPhone 4 or 4S was recently approved by the FDA, and it takes an instant EKG that you can then send to your provider. But AliveCor's mission goes beyond this, and they state on the website, "We want everyone to have their health at their fingertips. That's why we make the vital health signs of people and animals around the globe easily visible and actionable at exceptionally low cost." Dr. Albert, tell us a little about AliveCor.
Well, thank you, Joan, for inviting me to be with you here today. AliveCor is based on an idea I had back in the 1990s when I saw the power of, at the time, our personal digital assistants. That's an old term that we used to use for the handheld computers. But my idea couldn't be realized at the time because those devices simply didn't have the power, the computational power, the wireless connectivity needed. But that idea stayed in my head. And so when Steve Jobs, the late Steve Jobs, said he changed the world when he introduced the iPhone, that began back in 2007, 2008, a rekindling of that idea that I could put an electrocardiogram into the pocket of every physician, every nurse, every patient, every veterinarian, and enable cardiac health to be assessed anywhere, anytime, and to do so at the cost of an iPhone smartphone case. And so that became my mission, which is now turned into AliveCor. We've been very fortunate to raise significant equity capital and have excellent partners. And as you stated, we recently received our FDA 510(k) clearance to begin selling our AliveCor heart monitor. And I will give you an early notion that Monday, we just received word that our app has been accepted by the Apple App Store, and that Monday we will actually begin shipping our product to health professionals here in the United States. And soon they will begin prescribing that product. Now, I will say we have been shipping, but we've been shipping to veterinarians around the world. So we've well over 1,000 veterinarians in the last couple of months, and we've been doing ECGs on everything from dogs, cats, horses, to rhinos and exotic lizards and things at various zoos around the world because they have heart problems too. And so we take the notion that the portability, and here is our device. It's a case that literally just fits on to an iPhone and you snap it on, that this device enables you for less than $200 to do a clinical quality ECG rhythm strip and then instantly transmit that to a specialist, a cardiologist. And as I mentioned to you, there are 250-odd veterinary cardiologists in the United States and about 25,000 human cardiologists. So they are going to become the recipients of a lot more instant data. And we've been very fortunate. I have very prominent cardiologists such as Dr. Eric Topol, Dr. Leslie Saxon, who are great advocates, unpaid, never be given a dime, but who believe that the power of mobility, that this so-called mobile health, mHealth, and we believe we are an M-medicine company, a mobile medicine company, that we bring the power of traditional medical technology together with this incredible paradigm shift, disruptive technology of these smartphones that, quite frankly, are not just in the pockets of doctors, they're in everybody's pockets. Everyone. And this is going to be how most people in the world. So our products, used to be medical technology was really limited to the developed world, the US, Japan, Europe, and now smartphones exist everywhere because the only technology infrastructure that you have in South America, India, Africa, China is cell phone infrastructure. You may not have good electricity or good water, but you've got a cell phone. And so the smartphone and the devices and technologies we can interface to it will be the way healthcare is delivered bidirectionally from a patient to a caregiver, from a caregiver back to a patient. So we're just an early, let's just say we're early in that tsunami of disruption, but we're very excited because we can now bring, you can buy a smartphone in India or China for $70.
Mm-hmm.
And later this year, when we bring our technology out on the Android platform and others, we'll be able to have potentially, sub $150 complete wireless ECGs. That includes the phone and everything. And that enables healthcare providers to do cardiac assessment where it's never been possible before.
No.
And that speaks to me. I'll be honest with you. I've been in this business long enough that I really didn't want to do something if it was just going to be incremental. I wanted to be disruptive, as the Harvard
Mm-hmm.
Business School professor Clayton Christensen talks about disruptive innovations in his Innovator's Dilemma series of books. That's what this is. This is a disruptive innovation, and we at AliveCor are dedicated, as you said,
Yeah.
to bringing health at your fingertips, whether it's for your cat or whether it's for your mother, or your grandmother. And so, we are committed that, in this country, healthcare is unaffordable. It's something we're all dealing with and will continue to deal with, and we want to be a part of the solution, not a part of the problem.
Yeah, it's so easy. I want one. It's so easy. Let me see it.
Well, I'm going to show you. I've just got my password. So here it is. I just implemented the app. Now I'm going to touch my fingers through it. And now what you'll see is there's my electrocardiogram and there's my heart rate.
I can barely believe it. I'm
So
seeing it, but I can barely believe it.
seconds later, it's now in the cloud securely, able to be viewed anywhere in the world. And I'll give you an example. Back in the early part of 2013, there was a gentleman in Mumbai, India, who was from Nigeria, and one of our partners, Qualcomm Life, is a Qualcomm company, is one of our investors and one of our partners. And one of their people had our device and did a recording on a gentleman there. And literally, within 30 minutes, I viewed his ECG from my home in Oklahoma City, called the principal investigator, Dr. Leslie Sachs, the chief of cardiology at USC. She called him, and that gentleman was having a heart problem. And we diagnosed him literally from Mumbai, India, to Oklahoma City, to LA, back to Mumbai, and got him to a doctor. And another example is one that Dr. Eric Topol, who is one of the world's most famous cardiologists, he was on a plane this past year, and they called, is there a doctor on board? And he responded to that, and there was a gentleman with chest pain, and that gentleman had a stent put in a number of years ago, and he went down and put our device on the guy's chest, and he said, "Captain, you've got to land this plane, this man's having a heart attack." And so, I'm not going to tell you he saved that person's life, but clearly he prevented, that person got another stent and is doing well. He prevented something bad from potentially happening. And so that's the power of being able to have this kind of diagnostic technology literally in your hands, in your pocket, and available anytime.
How unbelievably fantastic. Thank you so much, Dr. Albert. I think that products like the AliveCor Health Monitor will lead to the really disruptive changes in healthcare that are necessary to reduce costs and raise the quality of care. It's just a wonderful, wonderful product. And thank you so much for talking to us about it today.
Thank you very much, and goodbye.